I'm Dr. T. Hunter Newsom, practice out of Tampa, Florida. I've done probably around 60,000 cataract surgeries, have about 8 offices, 3 different surgery centers that we've developed, and probably our claim to fame is we do a lot of different FDA studies for a lot of the different intraocular lenses, specifically a lot of the presbyopic or multifocal or depth of focus IOLs is kind of where our little niche is in the ophthalmology world. So for us, we've been a part of several FDA studies with Lenstec. So when in 2015, we first started implanting the lenses as a part of the FDA clinical trial, and we saw the excellent results that we've had through the clinical trial. It's been comparable with other multifocal lenses as far as distance, intermediate, and near, uncorrected, and quality of vision. And having that experience, once it got onto the FDA market in 2020, we started implanting them into our patients, and we implanted it into our office manager. And we've also put a Lenstec lens in my dad's eyes as well as my mother's eyes. So we've had a good relationship with Lenstec for a long time. So one of the advantages of the ClearView3 lens is I say it's a very forgiving lens, which is different than most multifocal lenses that we have on the market right now. So if you're off refractively or you're not right on, you start to see a drop in the performance of the technologies. But because this lens essentially is a monofocal lens up above, a monofocal lens down below, with about an 8% transition zone, it's a very forgiving lens in the multifocal arena. So patients don't have to be perfect in order to have really high quality vision. So doctors will notice they have less enhancement and less exchanges with this technology than they might have with other technologies. So the implantation of the ClearView3 is pretty simple and it's pretty easy. It acts like a normal plate haptic lens. Simply insert it like any lens that you have. Push down on the middle of the lens, it goes in the bag very easily. There's not really much difficulty with the centration of the lens or where it's going to go. It's got sort of a 4-point fixation, so there's not really much movement of the lens. You just put it in, get it in the bag, and it stays put. I really like to know what has the patient experienced. So if the patient's in monovision contact lenses, I'm going to use monovision when I do their cataract surgery. If a patient is in multifocal contact lenses and they have the rings on them already, they're very familiar and comfortable with it, I like to use that in the patients. If a patient's using a pair of progressive glasses, they're familiar with that technology, that's a great way to then say that soft tech lens, that ClearView3 is going to be a great option for a patient in progressive glasses.